Finding a doctor you like can be a personal and subjective process, but here are a few tips to help you find a doctor who meets your needs and your preferences. If you grew up in the US, you grew up seeing a pediatrician or family physician for your medical care. But oftentimes, once a minor becomes a young adult and they leave the home or move around for many reasons, they don't always establish care with a consistent primary care provider. Then, when they're sick, they go to urgent care instead of calling their primary care doctor first. A primary care physician is the doctor you see for regular checkups and who you should contact when you're sick. Your primary care physician, or PCP, is your main doctor. They manage your overall medical care and refer you to specialists when necessary for tests and other needs. They know you, and they know your medical history and take care of standard things like annual exams, prescription refills, and vaccinations. Your PCP is part of a group of providers within your medical home. Your medical home is a place where all of your information is together. Now, ideally, healthcare should be patient-centered, comprehensive, coordinated, accessible, and committed to quality and safety. This means that healthcare providers should be working with patients and their families to make decisions that respect their needs and preferences. They should provide a wide range of services to address all aspects of physical and mental health, and they should coordinate care across all parts of the healthcare system and ensure that patients can access care easily. They should also focus on improving the quality and safety of the care to help patients make informed decisions about their health. Your primary care provider may be an internist, a family practitioner, a nurse practitioner, or a physician's assistant. Now, some people use their gynecologist as primary care, but I recommend one of these doctors. A child's primary care physician is their pediatrician, family physician, and in some cases, a pediatric nurse practitioner or physician's assistant. Finding a doctor you like can be a personal and subjective process, but here are a few tips to help you find a doctor who meets your needs and your preferences. Ask for referrals. Ask friends, family, coworkers for recommendations. They may be able to provide valuable insights about doctors they've seen and can give you a sense of what to expect. They can also tell you which doctors not to see. Check online reviews. Read online reviews of doctors in your area to get an idea of what other patients are saying about their experiences with that doctor. And keep in mind that online reviews may not always be perfectly reliable, but they can be really helpful as a starting point. Consider the doctor's location and availability. Choose a doctor who is conveniently located and has appointments available when you need them. This will make it much easier to schedule appointments and ensure that you can get the care you need when you need it. Consider the doctor's communication style and shared culture or identity. It's so important to choose a doctor who communicates well and listens to your concerns. A doctor who takes the time to listen to you and explain things in a way you feel you can understand can help you feel more comfortable and confident in your own care. This may mean finding a doctor who speaks your native language if it isn't English, or someone who understands your culture or identity because they themselves share these things with you. So for example, many women prefer to see only female doctors, and a person of color may prefer seeing someone who looks like them. A member of the LGBT plus community may feel more comfortable seeing another member of the community, and so on. Consider your insurance. It's much more affordable to choose a doctor who's in network with your insurance plan to minimize out-of-pocket costs. Check the doctor's credentials. Now, this may seem silly, but it's really important to check your doctor's credentials and certifications to make sure they're licensed and qualified to practice in your area. You can usually find this information on the doctor's website or through your state's medical board. Once you've done this and you have selected a few doctors that you may want to see, schedule a consultation. Consider scheduling a consultation with any potential doctors to ask questions and get to know them better. This can give you a sense of their communication style and approach to care, and can help you determine if they're a good fit for you. Make sure to make an appointment to establish care even if nothing is wrong. In fact, it's better when nothing is wrong because it gives the doctor a baseline for how you normally are. It gives them a chance to record and review your medications, order baseline tests as needed, review family history, and find risks so that they can recommend screening tests or refer you to the appropriate providers. Now remember, a good doctor is like finding a pair of jeans. You may need to try a few on before you find one that fits. Medical professionals understand that they are not going to be the right fit for every single person. So it's important for you to meet with several people until you find somebody you feel very comfortable with. And that's okay.